The Prime Minister has conceded the aged care sector is in crisis as it struggles with COVID outbreaks and workforce issues. Key points. Scott Morrison says the ADF is not a shadow workforce for the aged care sector. Scott Morrison says the ADF is not a shadow workforce for the aged care sector. He said fixing the issues facing the sector are complex and need to be long-term. He said fixing the issues facing the sector are complex and need to be long-term. Aged care Royal Commissioner Lynelle Briggs says deaths among residents are failures of the government. Scott Morrison was thanking the people currently working in the sector when he began to say in a crisis, before correcting himself to say in a situation of this nature. He went on to say, "Now you heard me say crisis, and I know for many Australians, that's how it feels. That's how it feels for us. What is more important is that this is a function of a lot of pressure on the system. There are no simple answers. This is not a pandemic that does not have impacts." Mr. Morrison said he had asked the Defence and Aged Care Ministers to see what other support the Australian Defence Force, ADF, can offer, but made clear it was not a silver bullet for the current problems. The Defence Forces are not a shadow workforce for the aged care sector, he said. This is an urgent workforce need not just for now, but well into the future as well. The Prime Minister also noted that of the 60,000 ADF members, half of those were in the reserves and many were already working in the health sector supporting systems during the pandemic. Lynelle Briggs described ongoing practices within the aged care sector as neglect. AAP, Kelly Barnes. His comments come after one of the Aged Care Royal Commissioners said the system was in crisis due to the federal government's failure to prepare for an ongoing COVID-19 pandemic. Commissioner Lynelle Briggs said it was completely unacceptable that elderly people had been isolated in their rooms for months without regular showers and care. What we're looking at in aged care is months on end with no one visiting them, and sometimes dying alone, Ms. Briggs said. It really shouldn't be allowed to happen, and the government should have sorted its strategy out for how to prevent this happening again. Ms. Briggs said the lack of preparation had taken a bad situation to a crisis. The Royal Commission into Aged Care Quality and Safety handed down its final report last year. Titled simply Neglect, it painted a harrowing picture of nationwide failures to care for elderly people. The commissioners recommended significant and urgent work to improve the workforce and governance of aged care. Minister for Aged Care Richard Colbeck is facing calls to resign after deaths in aged care in just the last month outstripped those for the entirety of 2021. A total of 777 aged care residents have died with COVID since July last year. Around 500 of those deaths occurred last month. Senator Colbeck has denied the system is in crisis, saying deaths in Australia have been lower than overseas. But Ms. Briggs said that wasn't good enough. The fact that we're doing better than overseas on deaths in aged care is not the answer, she said. We were quite clear in the reports we put through that the life of an older person should be valued equally with the life of a younger person. We shouldn't be seeing the disproportionate impact on this group when we've known for 2 years they were particularly vulnerable to the disease. Richard Colbeck told a COVID-19 committee the aged care sector was not in crisis, though ongoing issues were exacerbated by COVID. ABC News, Adam Kennedy. When asked about the problems in aged care on Channel 9, Defence Minister Peter Dutton said it was difficult to find the balance between protecting residents and ensuring they were not left isolated. You can't argue on the one hand that people feel isolated and you want to allow loved ones in, which is the natural reaction, but then say we're surprised when Omicron is introduced into aged care facilities, Mr. Dutton said. It's a witch's brew, it's difficult to deal with. Government short-sighted not to back pay rise for workers. Earlier this week, the federal government said it would offer 2 one-off payments of $400 to aged care workers in recognition of the continuing difficulty of work in the sector. The payments also serve as a retention incentive, as more than a quarter of shifts are reportedly going unfilled in the desperately understaffed sector. But the government has rejected pressure to back a Fair Work case for a $5 hourly wage increase for aged care workers. Unions and the opposition have called the $400 payments an insult to workers. Ms. Briggs said the Royal Commission had warned a year ago the sector had a shortage of workers, and those it had were underrecognised, underpaid and underskilled. She said the one-off payment was simply not enough, and not backing a pay rise was short-sighted. I had been expecting that the government would join with employers and employees in this case, she added.